Good evening, Prof.
Good evening, sir.
Good evening, Prof.
Sir.
Good evening, sir.
Good evening, Prof, sir.
Good evening, Prof.
Good evening, sir.
Good evening, Prof.
Yeah, thank you. Let me welcome you all to this lecture. In fact, this is another another course. Last 2 weeks, we started the course on research methodology, and anyway, I don't know if you remember that we said we are going to stretch the course on research methodology. We have to stretch it into next year. So, we have concluded it. It's not that we have concluded it, but we decided that we have to teach you. We have to give lectures close to the time you will require. We will need that knowledge. Close to the time you will need that knowledge, because the course on research methodology is to give you the competence to do your research work. Okay, and so we are going. There is no need to teach you everything at once. We over the years we have realized that students tend to forget. So it is better to teach them close to the time they will need that knowledge. Okay, so we have not concluded the course on ICT and research methodology. We only paused it, and you have actually also done two end of week tests. You have also done two end of week tests. You are not done with the course. Next year you will still have additional tests, and we are going to add all of them to arrive at your score. Score for this particular course. Okay, so the lecture today we are starting a brand new course, and this course is the second of our graduate school course, and it is on management and entrepreneurship. I don't know, a lot of you, especially those that without previous contact with the school, with the University of Port Harcourt. University of Port Harcourt is said to be an entrepreneurial university. What it means is that we don't just in the University of Port Harcourt, they don't just award academic certificates, but they want to teach you. They want to teach and then encourage you to apply that knowledge. In setting up a business. Okay, in setting up a business. I must say that I have been a very fierce critic of how this particular course is being run in the university, because I know that especially in the undergraduate program and undergraduate programs, they do teach people how to make liquid soap, how to sew, how to do funny things, things that I believe are not befitting of a graduate. They are not befitting of a graduate. Graduates, and of course postgraduates, they are very skilled people. They have, if you have a master's degree, it means that you have gained a mastery of that aspect, that part of knowledge. And if you're a master, enough, you must apply. Knowing is not enough, you must apply. Knowing is not enough, you must apply. Of course, I'm sure during the induction course, we told you that there's actually two master's degrees. One is academic, and the other type is professional. One is academic, the other type is professional. Academic degrees, they lay a lot of emphasis on research. They lay a lot of emphasis on research. Okay, and most of them are things like the MScs, Masters of Science, degrees. Okay, whereas the professional degrees, their emphasis is on the competence, practical knowledge. Incidentally, when public health started, when the MPH degree was conceived, it was originally conceived to be a professional degree, to empower people, to empower the holder to become a public health practitioner, okay? And that's why in some places they say, you may not use an MPH to do a PhD, because PhD is a master's degree. It's an academic degree, and MPH, the purest form of MPH is actually a professional degrees. But the difference between a professional degree and a master's degree is the fact that in professional degrees, they lay emphasis on the practice, and they may not require dissertation. They may not require dissertation before the award of the degree. But their own MPH is different, because we'll expect you to do research, write up a dissertation, and defend it. So you have that. So there is that academic component of the MPH degree. So which means that your MPH, the MPH of the School of Public Health, and I know that the MPH program of other universities in Nigeria, they are both academic and professional. Academic in the sense that they will expect you to carry out a research and then and defend it. Professional, because they place a lot of emphasis on practical skills. I must say that although in the School of Public Health, we have always emphasized the practical aspects. So when we teach you, we don't just teach you the stuff, the theory. We try to apply. We try to apply the knowledge into practical into practice. Okay, into practice. And we also suspect that perhaps it may not be enough, and that's why we try to augment your program with those short courses, and those short courses are competency based certifications that will improve your employability. Yes, the employability. Remember that under normal circumstances, in places, employers, they look for competence. They are not interested they are not so much interested in certificates. If they ask for certificates, that certificate is supposed to be a certification of certain level of competence. So if you add additional certificates, probably from those short courses, it means it improves. They tell your employer that you have additional competencies apart from the one that is standard for, say, a person with a MPH. And that's why we will continuously encourage each and every one of you to register for those courses, despite the financial constraints. It can take time to between now and probably next year to register. In fact, you can even register very close to the commencement of the degree. In fact, perhaps we should even introduce a credit scheme, just to enable you register and then you can pay at certain points. We will look at that option, but we are interested. We're interested in letting you have that competence, those competence, the competencies that are expected of a holder of the MPH. For those of you in community operational medicine, in fact, the fact that medicine is there, means that it's even professional. Although we call it an MSc, but it has to do with the practice of occupational medicine. So, which means that it is inherently professional. It is professional, even if we have added the MSc to it. Okay, so this course is about how to convert your knowledge into business, and of course, from business into money. Okay, from business into money. And then we have said, okay, so when you do that, you will become what is known as entrepreneur. So it's not only what's that? It's not only Sabinus. It's not only Sabinus that is an entrepreneur. So when you are able to apply your knowledge, this knowledge, you will become sorry. So when you are able to apply your knowledge to create a business with the purpose of making money, you can now be called an entrepreneur. And that is what we want to encourage you. That's what we want to teach you in this course. It's not when you finish, it's not to begin to look for work. I'm sure that even the job prospect has actually decreased because of this Trump thing. Because NGOs in Nigeria used to be funded predominantly by USAID, but right now Trump has cut the funding, and the NGOs are not as functional or as lucrative or as many as they were. So, which means that for you to actually make something out of this your degree, you should be able to apply what you know, what you have been taught into what you have been taught into convert it into a business. And when you convert into a business, you can now be called an entrepreneur. So we want you to become an entrepreneur, especially if you can't find job. If you can't find job immediately, you can become an entrepreneur by converting what you have been taught. To a business that can make money, a business that can make money. Okay. Okay. And you. Okay, so you can actually, from what we have taught, you can create a business by using your research skills and your professional skills. Research skills and your professional skills. Professional skills are those practical skills we have been taught, not only in this program, but also in the short courses. While the research skills we are teaching you in the course on research methodology. So what are the steps? There are steps what are the steps involved in creating a business? Creating a business with what you have been taught. What are the steps? Okay, the first one is to identify public health problems that can become a business opportunity. So the first step is to identify public health problems that can become a business opportunity. So public health problems that you can make money from. Okay, so you have to identify those problems. Then the second step is to find solutions to the public health problem. Remember, not all public health problems you can make money from. If the problem, okay, so the step 2 is to find solution to the problem. Step 3 is to create a business venture to sell the solution. You create a business venture to sell the solution, and then the fourth step is to market the business solution. To market the solution to make money. Okay, so 4 steps. The first is to find a problem. The second, find a problem that you can make money from. The second step is to find solution to the problem. The third is to create a business to sell the solution you have found. And then the fourth step is to market it to increase the number of use, to market it to create customers, to get customers. Okay, so the first step is to find public health problems that you can make money from. Public health problems that you can make money from. Okay, and not all public health problems you can make money from, but these 4 types. There are 4 categories of public health problems you can actually make money from. They include public health problems with political will, public health problems with corporate interests, public health problems that are of interest to philanthropists, and public health problems of global concern. These 4 types or 4 categories of public health problems you can make money from. These 4 categories of public health problems you can make money from. And we are going to take them one after the other. Public health problem with political will. These are public health problems that are of interest to political leaders, especially in Nigeria. These are public health problems that are of interest to political leaders. You know that in Nigeria, there is no much difference between the money of a leader, say a governor or a president, or even a local government chairman, and the public coffers. There seems to be no demarcation because they think that is their money. In fact, when they are building, if they build a road or a flyover or something, they said, I have built. Not the government has built. Not that their government has built that, but they are the ones building. Yes, but actually they are not. They are not the one that built. They built with public money. But we know that in Nigeria, there is no such. Highest, they can claim to have built it with security votes, which we are told is not usually retired. So you don't retire security votes. So even if the security votes can be up to 1 billion or more in a month. So which means that they can spend. So the thing there is that if you find something, if you find a project that is of interest to a political leader, it will sell. You can make money from it. You know, the first ladies, they used to have their pet programs. Starting, I think, Miriam Babangida, the wife of IBP, then started with I think better life for rural women. Abacha's wife had her own, and so forth. And I think the current first lady of Nigeria, I don't know, I can't remember, but she is actively doing something. She's actively doing something. Okay, so anything that is of interest to political leaders, you can get involved. You can get involved. If it is gender-based violence, anything that is of interest to them, you can key in, and then yes. The other one is things that are of corporate interest, things that are of interest to corporate bodies, especially big companies. Oil companies, for example, oil companies are said to be polluting. They contribute to climate change. Okay, so which means that you can even go into what they call the carbon credit scheme. And carbon credit scheme involves the planting of trees or doing things that will capture carbon dioxide from the atmosphere. And you can sell the carbon credits so generated from planting steels to the oil companies. And you can, yes, for the oil companies. And in Nigeria, we have what they call the corporate social responsibility. A corporate social responsibility are projects carried out by corporate bodies from their corporate bodies that is tax deductible, which means that the money these corporate bodies spend can be deducted from their taxes, which is these companies deciding what to do with their tax. Okay, so you can decide which one, the ones that are of interest to these companies, especially companies that are rich, like the oil companies. Oil companies will like carbon credit scheme, tree planting, and things that will tackle climate change. You can even do climate change resilient projects, like encouraging people to even do dry season farming and things like that. Okay, and then yes, dry season farming and things like that. Then the other one is that things that are of interest to philanthropists, big philanthropists. They have a lot of money. And there is a level of wealth you'll get. You'll get into what they call self-actualization, self-fulfillment. You want to do something that is of interest to you. So a lot of some billionaires, I'm talking about dollar billionaires like Bill Gates, they have made a vow that they are going to give out most of their wealth before they die. So they have a lot of money to give out. How do you get the money? You get the money by doing projects that are of interest to them. Look out for those projects. Projects that are of interest to them. The good thing is that health programs are always good, always popular. Because especially those that are religious, or those of Christian faith, or even Muslims, is already written in the Bible and the Quran. In the Bible, they used to say that if you love me, feed my stock. Feed my flock. And they were saying that when I was hungry, you fed me, and so forth. And of course, in Muslims, zakat and other charitable giving are seen. So if things are well structured to tap into all those, you can create a business to tap into all those things. Okay, so you have to seek out for these. You have to seek out for these philanthropic individuals and then try to get resources. For example, Bill and Melinda Gates Foundation or Bill Gates Foundation, they are interested in polio eradication, immunization, computerization, placement of computers in schools, and then they are also interested in malaria vaccine. So our own Dangote he has the Aliko Dangote Foundation. They are interested in quality education, economic empowerment. T.Y. Danjuma also has his own. So, and other foundations are coming up. It's just a matter of looking out for them, and then applying to see if you can get a grant from them. The only problem we have in Nigeria currently is this problem of 419. Any of such, most of such solicitations of funds are usually treated as a scam until proved otherwise. But getting funding from philanthropic organizations or individuals used to be very, very a good thing. Then the fourth is a problem that are of global concern, things that are of interest to the whole world, things that are of interest to the whole world. We read about the sustainability of Earth, the ability of Earth, of planet Earth, to continue to accommodate human beings. Not only because of climate change and even the size of our population. So if you have something that is related to climate change and then population control, you can get some funding. You can get from UN, United Nations bodies, NGOs, and individuals. There are certain individuals that are ready to do something. There is a concept called the carbon footprint, where individuals they want to remove or reduce the amount of carbon dioxide they are emitting, because they are interested in the sustainability of the whole of the sustainability of the Earth. In previous, the first course, we introduced this concept of global public health good. So if you do, global public health good are goods or products and services that, and when an individual uses them, they benefit. The individual gets benefit, and the benefit even extends to the neighbors, and not only the neighbors, but also people from far away countries. For example, vaccines. If you take a vaccine, it means that we are not going to transmit the infection to the next person, and you are not going to also transmit or travel to another country and infect others. So that's why it's usually in their interest, the interest of those developed countries, to do something to stop diseases in developing countries, because such diseases can be transmitted can be brought into their countries. For example, mpox, that was formerly called smallpox. Monkeypox. It's a lot of the epidemics happened in Nigeria and other places, but it found its way into the developed countries, and then became a serious epidemic, and then triggered off a serious epidemic amongst homosexuals. And that is the reason. So it's one of the reasons why they want to do something. So if you are planning, if you have something to do with vaccine, contraception, and all the and the related things that are of public health, that are public health goods, be sure that you can make money from them. We have talked about climate change and all this. Okay. Okay. All those things. Okay, that's the first step. That is the first step. I think we'll just quickly take the second step. The second step is to find solutions, to find solutions to the problem. So it's not just enough to find the problem that that can generate businesses, businesses that you can make money from. But the next thing now is that you have to find a solution. You have to find a solution. In fact, the richer you want to be, the more needed, the more needed the solution will be. Okay, so they used to talk about the hierarchy of needs. That in human beings they have the hierarchy of needs. And one of the first need is food. Is food. So if you want to do something that has to do with food, it will be all right, because people eat food. Okay, and right now, although in the developing countries like ours, the problem is availability, food security, whereas in developed countries, it's actually the nature of the food. They are interested in healthy food. They are not interested in just food, but healthy foods. So you have to find solutions. You have to find solutions to it. And what are the solutions? The WHO used to talk about building health system. Dr. Alabere and co, they taught you, I'm sure that they taught you this health system. There is a course on health system, and they would have been taught about this WHO 6 building blocks. These are the things, the blocks that are needed in the health system, and these are the blocks that are needed for healthcare delivery in a particular place, in a particular community, in a particular country. What the things that are needed, and they include service delivery, where health workforce, health information, health product, vaccines and technology, health financing, and leadership. So, which means that you can find solutions in any of these 6 blocks if you want to, since you have skills in healthcare, you're a public health practitioner. So you can target these 6 building blocks and look for a problem, and then find a solution to that problem. So let's start with service delivery. We know that, in fact, let's just start with our own in public health. Or we have also told you that, of course, taking care of the health of the people are of 2 broad types. We have public health, and then you have medical care. In public health used to be, for example, this our MPH degree, used to be a doctor-only program. In Nigeria, they were only admitting doctors. Okay? They were only admitting doctors. But right now, it has opened up. Okay? Which means that other health workers, other persons, even persons that are not doctors, are also coming into being. Because public health has also changed. The practice of public health has also changed from what they call the horizontal public health of the medical officer of health to vertical public health of the control programs. Okay, so if you are in malaria control, for example, you may not are very, very important. So a knowledge of entomology, deep knowledge of entomology, maybe you can retrain to become a public health practitioner and then provide this service. Okay, in Nigeria too, the Japa syndrome, people are going. So, which has also changed. But one thing is this ICT. ICT has made it possible for us to have this lecture, this program, to run this program, to have all of you all over the world, all over the country, and even outside the country attending this lecture. One thing we believe, the opportunity, we have a lot of opportunity in incorporating ICT in our healthcare delivery. And to me, this is where the opportunity lies. This is where the opportunity lies. Okay, this is where the opportunity lies, and that is what they call the first move advantage. If you become the first person to incorporate ICT in the delivery of health services, I'm sure you are going to make a lot of money. Yes, you are going to make a lot of money if you become one of the first. So you should be in a rush. In fact, I can't even wait. I can't even wait because I want to get involved. ICT. And there are various ways you can use ICT. You can incorporate ICT. If you have a knowledge of ICT and the knowledge of the health services, with what Dr. Labra and Co. Have taught you, you should be able to create a product or a service. And opportunities include telemedicine, being able to provide medical care using ICT. And this is an aspect. This is one that I'm very, very interested in. In fact, I was just thinking, in fact, I've gone to register a company I've called Remote Consult, and I just believe that one can make it possible for consultations that can be carried out using ICT. Using ICT. So although such opportunities exist, so we can. And then adherence counseling, where patients can be encouraged to take their drugs as and when recommended, especially if they have chronic diseases like tuberculosis and HIV. One can create such to encourage them. Then helplines are increasingly being used in developed countries. Yes, once they are getting into winter, the sicknesses, diseases, illnesses increase, illness episodes increases. So helplines and online telemedicine are actually assisting them to do that, to offer services, patient appointment systems, contact tracing, and a lot of other things. There are lots of opportunities exist from ICT through the use of ICT. Okay, for the workforce, okay, we are also talking about the JAPA. If we don't have enough health workers, we can get. If we don't have enough health workers, others can be trained to take over some of the responsibilities. What they call tax shifting and tax sharing. Okay, so I told you that public health has shifted from physician delivered to non-physicians. So it's almost like in public health, the tax has shifted from doctors to non-doctors. So when you shift that tax, the thing there is that there are problems. The problem is the risk of poorer quality care. So how do you ensure that the other person carrying out, providing that service, is not providing standard care. You can use ICT. You can also train them. We talked about that remote consultation, meaning that a non-doctor can actually run a clinic if he or she is assisted. He or she is assisted by a doctor working remotely. A doctor working remotely and even directing the non-doctor what to do. And this same thing can be applied all across the health sector. The health information, it can provide information online. In fact, it also gives us opportunity now. The social media gives us an opportunity to be creative, to provide education. They said the apricot doctor is doing well. Nothing stops us from also venturing into that area. Nothing stops us from venturing into that area. For medical products and vaccines, medical product vaccines and technology, we can also create something. We can also create something using this what they call reverse innovation. So if there is an existing product, you can redesign the product. You can redesign the product to make it cheaper. You can redesign the product to make it cheaper. The good thing is that we have China. China is the factory of the world. So if you want to create a cheaper iPhone, you can go to China. Go to China and they will do it for you. The only thing is that you shouldn't let a very dark man know about it. But you can. It can be done. It can be done, and it is called. This is called reverse. Reverse innovation, and that is the reason why. That is the reason why in the services in India are cheaper, significantly cheaper, because they remove the luxury. They remove the luxury and give you the service cheap but effective. In India, they can do complicated surgeries, but instead of putting you in a private ward, as they would have done in developed countries with gadgets and with a nurse watching over you, one nurse watching over you, the Indians can put you in an open ward, with a fan, and charge you less. Okay, and charge you less. So they have done the same surgery, but they have removed the luxury to make it cheaper and affordable to all. Okay, so we have to think about that. The other thing we have to also think when we are looking at solutions is what they call the appropriate technology. A technology is said to be appropriate when it is scientifically sound and socially acceptable, yet it is safe, effective, affordable, and can be operated and maintained and repaired by members of the community that is designed to serve. So it means that you have to be, so if you are the solution you are looking for, you should be able to use it in the place, in the community you want to do it, in the community you want to use it. So if the community doesn't have electricity, you can find another way of powering it. And the good thing is that we have this solar, and you can actually install solar in places, in places, and with that you can even run most of your equipment using solar. Okay, So, so the appropriate technology, and we have already existing appropriate technology, very common ones like the simple delivery kits. What at times they call it mama kits. It includes most of the things that are needed for safe delivery. They are put in a bag to ensure that women, even when they are patronizing TVAs, that their delivery is conducted in the hygienic environment. So if a woman, that is an important thing, is to encourage. So the mama kit containing simple things, containing a blade razor blade, cord tie, something to tie the cord, a bar of soap for hand washing, a plastic sheet, so that at least the TBA can spread it on the floor, and not just tell the woman to lie on top of a dirty on the ground or something that will expose her to infection. So this is a simple delivery kit. It's ensuring or helps with clean delivery. And so, in fact, some are already packaging them and selling them, or not only that, they are even getting people to philanthropies to buy, to subsidize them. For example, the First Lady, Oluremi Tinubu, I think I've had her donating mama kits to in a state. I'm sure that, of course, obviously, she wasn't the one that packaged those mama kits. It's probably someone that can be you. The good thing is that these mama kits are cheap. They are cheap, so you can package them. And sell it to local government chairman. Pitch the idea to the wives of local government chairman. I'm sure that you'll be able to get funded. Okay, mama's kids. The pantograph helps women, helps in monitoring labor. It's basically a graph. Basically a graph. One can decide to make it available. Offer some trainings, and make it available to health center. Offer some trainings, and they can be sponsored. They can get a sponsorship, and then the rave of the moment. The medicalization of food and talk. That is the use of talk in the management of diseases. Remember how those faith healers, how do they heal people? They heal people with talk, word of mouth. So although we told you something about communication, behavioral change communication and things like that. There are certain things there are words that can move mountains, So if you get trained, or if you apply some of the knowledge, some of what we taught you in that course on health communication, you'll be able to medicalize talk. You'll be able to say things, and the part of the medicalization is the treatment, is the self-management, is teaching people with chronic diseases like diabetes how to manage their disease. In fact, diabetic self-management to be the best. In fact, a diabetic patient is not said to have received a quality treatment without accept he or she management education, because diabetic patients are responsible for more than 95% of the treatment they receive. The thing is not to give them the highest is not to give them consultant endocrinologists to manage them. It's not to even subsidize their drugs, but to teach them what to do, when to do them, and how to do them. So diabetic self-management is very, very important, and you can start one. You can start one. In developed countries, all diabetic patients, once they are diagnosed, they are referred to a diabetic self-management education program hosted in hospitals, government hospitals, or in the ministry of health, of the county, of municipality, or any, but funded by the government, or by some NGOs, private individuals, to provide this training, so you can actually go get involved in that. Get involved in that. It is virgin in Nigeria. It's virgin in Nigeria. So you can actually get into that, go into that. And the good thing is that with ICT, with Zoom like this, when you start the program, it means that your clientele may not be program in such a way that it is translation of food. How do we use food in the treatment? Very, very important in hypertension. Very, very important. Very, and even more important in diabetes. How do we make our staple foods better, good enough to be used in the prevention and treatment of these diseases? And of course, we are being told to fruits. We are being told to take fruits and vegetables. How do we ensure that we have fruits all year round? How do we ensure that we have fruits all year round? In developed countries, they have been able to do that. They have been able to do that. In developed countries, they have the ability to slow the ripening of fruits, and they have the ability to hasten the ripening of fruits. And that is why they are able to have fruits all year round. And that is why they are able to ship, say, banana from the West Indies to Nigeria. That is why they are every year, all year, you are able to buy apple, irrespective of the season. The tax for us is to make it happen in Nigeria with our local fruits. With our local fruits, we have a lot of them in the north central zone. But how do we make them? We can go into the business. And we should be able to do it better. We should be able to do it better than those illiterate. Yes, because we should have the knowledge. But we must also say that in some places, in some instances, they are more knowledgeable than us. Being told before, we'll notice that their plantain, they have this long stack. And you'll be wondering, why is the stack that long? It's because the longer this stack, the slower the plantain will ripen, or the plantain or banana will ripen. And that's why they will keep the stack very long. They'll cut it very long, in order to delay the ripening. Okay? So it is a knowledge they have acquired. It's a knowledge that they have acquired, And we can, when we get into that business, I'm sure we'll be able to do it even much better than them. Much better than them. Okay, for the staple foods, we should be able to process them into forms that are better. Our staple foods, their glycemic index are said to be moderate. That is, medium. The glycemic index is a measure of how fast a food will release its glucose content. How fast a food product will release its glucose content. Cassava, yam, and a lot of our staple foods, they are pretty fast. But we can make them, we can slow them, we can decrease their glycemic index by reprocessing them. And part of the process, one of the ways of reprocessing them is to add fiber. Interestingly, fiber in the case of gari or even cassava, fufu, they are usually discarded. So, which means that high fiber gari, which is better, which is good for diabetic patients and those that want to lose weight, should even be cheaper. But if you are packaging it, you can even sell it at a higher price. You can sell it at a premium. So, which means that there is even more money to be made. Through the processing and sale of these high fiber products. Okay. Then even from palm oil, the palm oil usually will have 50% saturated fatty acids and 50% unsaturated. The saturated fatty acid are the fatty acids that are capable of raising the cholesterol level. But the top of the palm oil, like this top of palm oil, this top of palm oil contain less saturated fatty acids, which means that they are better. So if you want to reduce your cholesterol level without reducing the amount of palm oil you use, is to use the top of the palm oil. So with this knowledge, you can actually produce and market a heart-friendly palm oil. A palm oil that you can say is heart-friendly. You can say it's heart-friendly because it's lighter. It's lighter, and because it's lighter, it will contain less saturated fatty acids, and therefore can be said to be heart-friendly. Another way we can make money is healthcare financing. I'm sure you are also taught in health management, and yes, when you did those health management courses, especially the ones that you can use is this community health insurance scheme. It's just a matter of getting in touch with a health facility and then arranging an insurance scheme, collect money upfront, and render certain services, what they call the benefit packages. So you collect premium and you render benefit packages. And I must say that, of course, the Obio Cottage Hospital that was funded, the community health insurance scheme of the Obio Cottage Hospital has shown us that this can be profitable in Nigeria. It can be profitable in Nigeria. It's just a matter of packaging the benefit package, working on the benefit package. And I must say that your benefit package may not cost a lot, but will improve their service. For example, preventive services in Nigeria are either subsidized or provided free of charge, which means that you can add immunization services. You can add immunization services. Contraceptives are provided either free of charge or heavily subsidized. You can decide to also include free contraceptives, and you can get those contraceptives from the Ministry of Health. You can get, and from some NGOs, and then HIV treatment is free. TB treatment is free. In fact, I don't know, RDT for malaria tests, and even some malaria drugs can be provided free of charge. You can get them. They may be available at the Ministry of Health, so you can get them. So you can easily provide free services like you can easily include services like HIV treatment, TB, malaria, contraception, immunization services, and a few others. And once you are able to provide them, members of the community, and you are consistent, members of the community, they will be ready. They will be ready to provide the service, to patronize it and pay the premium. Okay? And then the other one is health leadership. You have enough knowledge. You have enough knowledge to be you may not be, even if you are not the CMD or the chief medical director of a hospital, but you can be a valuable assistant, being able, valuable assistant by providing information. You have been taught health management, which means that you can find a way to utilize the health hospital data for the evaluation of the services, supply chain management, human resource management, efficient management of services. You can help them do that. You can help them do that. Okay, so we have talked about the problems. We talked about the steps involved in making money from what you have been taught. The first one we said identify the problems, and we said problems that you can make money from can be categorized into 4. Problems with political will, problems that are of interest to corporate bodies, problems that are of interest to philanthropists, and then problems that are of global concern, like global warming, and of course human overpopulation. Okay, so those 4 areas you can get. And then we said the next thing is to find solutions. And we were talking about the 6 pillars, and we said you can actually create solutions in each of these 6 pillars, either in healthcare delivery, especially ICT, and then up to medical products and so forth. So let me pause here to if there are questions or comments. Okay, I think Augusta has a question. Augusta.
Good evening, Prof.
Yeah, good evening.
Thank you for the wonderful lecture. My question is concerning the good storage of food. So
Yeah.
are you saying that I saw in the slide that talk about use of carbide to
Yeah.
ripen food so that this food can be sold immediately in the market? So is it that those practices are good? Like the side effect of using of carbide to ripen food. Most of these things, the market women do those things, and we don't know whether it is safe for us to take those food.
Yeah. Okay, let me say that let me say that fruits ripen by releasing ethylene oxide. That is a natural. It's natural. But in Nigeria, the farmers somehow, I don't know whether they stumbled into it, and they realized that carbads can be used. Carbads generates ethylene oxide. Ethylene oxide. So, and that is probably how they started using it. But actually, carbide, that is the calcium carbide, is carcinogenic. So if in course of using it, it contaminates the fruits, then it is dangerous to health. But in developed countries, they have safer ways of generating ethylene oxide without using carbide. In fact, if you Google, those ways can come out. In fact, even if you I know I was interested in those, and I had one or two ordered from Amazon. Yes, and Alibaba. So there are safe ways, but the problem we have in Nigeria is that we don't have people trying helping to solve the problems, our own problem. We don't have people. We don't have people actively researching for safer ways, and that is why they are using it. So, Augusta, it is dangerous to use carbide, especially if it contaminates the fruits. But fruits naturally they release ethylene oxide, and that is the reason why if you tie a banana, if you want it to ripen, I'm sure that you would have tried it, is to put it in a polythene and then tie it. It ripens not because of the heat or the airless condition, but it's because the the ethylene oxide that is released naturally is retained within, and that is what helps it in ripening. That is what hastens the ripening. Okay.
Thank you, sir. Thank you,
Yes.
sir.
Yeah. Okay. It shows that we are listening. I think when I taught the other part of the master's class, they also asked that particular question. Okay, so if there are no questions, we will move on. You have found a problem, you have created the solution. Now, how do you make money? How do you create a business from the solution? You can't create a business using, again, 4 steps. You have to professionalize your competence. That is, you have to find a way to apply what you know. You have to find a way to apply, professionalize the competence. You have to get the necessary certification. You can gain advantage by starting the business as an NGO and then raise money as a social enterprise. So we have these 4 ways of starting this business. Professionalize, get certification, gain advantage by starting as an NGO, and then raise money as a social enterprise. To certify, to professionalize, is to find a way to provide the service. Find a way to provide the service. The difference between professional courses, all professional courses, they have a way of applying their knowledge. They have a way of applying their knowledge. In law, Lawyers, when they go in the university, a lot of times they train them, they give them the the knowledge. But it's at the law school that they will teach them. They teach them how to practice as a lawyer. Okay. So in medicine, in the medical school, they teach medical students not only the knowledge, but also how to apply the knowledge. And then in medical school, you have something called clinical methods. Clinical methods will teach you how you can sit in a consulting room and see the patient. Sit in the consulting room and should be able to see any patient, no matter the type of health problems. You should be able to handle it. It's part of the training. So it is not enough to find a solution. You must find a way to apply it. And I must say that this is the difference between those in in basic science and those in professional courses. I'll give you an instance. I was given a responsibility to tackle the mosquito problems in our teaching hospital. That is the University of Port Harcourt Teaching Hospital. When I was given that responsibility, I went into the university and found an entomologist in the Department of Animal and Environmental Biology. A fantastic lady, very knowledgeable. Knows everything about my mosquitoes. But I had to come in to organize a way of arriving at the problem, the mosquito problem, the cause of the mosquito problem. Okay? So the first thing now is to actually identify the mosquitoes and find their breeding grounds. You have to find their breeding grounds. And if you identify the mosquitoes, find their breeding grounds, and then control it. That is the best way to control it. And then when we spoke to people, of course, which means we have to collect information. And that information, we talk to patients when the biting behavior of the mosquitoes. And they said the mosquitoes, they bite day and night. They bite day and night. And if they bite day and night with almost equal intensity, then it's not Anopheles. Anopheles mosquitoes, they transmit malaria. So those that bite day and night are not usually Anopheles mosquitoes, they bite nicodemously. So that's one. Then the other thing is we started looking for the breeding grounds. And those breeding grounds, the teaching hospital is built on a swampy area. And what we did was to collect samples of stagnant water, and we tested them. Of course, I'm not the one that tested, and we were able to identify the main source. Okay? The main source. Okay? So, whatever you know, whatever your knowledge, whatever solution you have found, you must be able to apply it, find a way to apply it. So it may mean that you have to create an office. Or can we say a consulting room? After all, even lawyers, they have a place or a business office where the client will have to come and then find and then you offer them your solution. Okay, so you have to do that. You have to do that. Personalize the service. The other one, you have to get the right certification. The right certification. And the right certification is to get registered with a professional body, depending on what you want to do. And if there is no registered regulatory body, you have to go and look for, if they have a professional association, please register. And as much as possible, you can get additional certification and permits. Of course, doctors, nurses, pharmacists, they have registration councils, registration bodies, environmental health officers. So if you want to practice, you have to ensure that you are registered. At times, they insist on being trained in a certain way in a certain institution. Other times, they set qualifying exams. Find out how these bodies register their members, and then you can, yes. And if that area, your area of practice, if the area you want to practice doesn't have a registration body, you can look for professional associations. If you are interested in the environment, you have associations like Nigerian Environmental Society, Association of Health Impact Assessments, Public Health Association, Epidemiological Association of Nigeria, even Nutrition Society of Nigeria, and so forth. So it depends. It's always good to have a professional, a member of this professional association. It's always good because it gives you contacts. It gives you it enables you to be in contact with other persons and even get involved in their training. And at times, other certifications are also necessary. Not only the certificates you have, but also short courses. They are also helpful in that regard. And then, of course, we are talking about these short courses. It gives you that certification. And if you are working in a team, especially those in a field work, if you are working in a team, you are more likely to be employed if you are able to serve more than one purpose. For example, in an EIA, that is, if you are doing environmental studies, working as a team, it will be good if you in addition have other certification, like if you are a trained first aider, or you have training better. If you have training in basic life support, you are more likely, because oil companies, for example, they will always want the team to have a trained first aider or somebody that is knowledgeable in basic life support. Because if you are working as a team in a remote area, if there is an emergency, they will want somebody to provide first aid to stabilize the person before calling for further medical treatment. Okay, so it gives you that advantage. Okay, and then the other thing too is this: there are certain jobs that requires certain certification, like in the oil companies. If you are working in a riverine area, they want to make sure, they want you to at least know how to swim. So you must have a valid swimming certificate. You must have the ability. And if you are working offshore, they want you to have a training, what they call the underwater helicopter underwater escape training. Under helicopter on Hewitt, helicopter underwater escape tests. They want you to have that, so that in case of any crash, you should be able to come out of the wreckage of the helicopter. Okay, so such certifications are necessary if you want to boost your ability to be employed in these places. Okay, so the other one is the next is to start the business. Start the business as an NGO. If you start the business as an NGO, NGOs are not usually taxed. They are not usually taxed. And because they are not usually taxed, it means that you can offer your service at a lower price. And if you offer your service at a lower price, it means that you are likely to have more patronage. So that is the reason why it is better to start your program, your business as a social enterprise, Social enterprise are a social entrepreneurship is the business set up not just to make profit, but also to help social problems. And so, which means that if plastic pollution and a lot of things, even waste management can be a social enterprise. Waste management. After all, those persons, those cart pushers are making a lot of money. They're getting a lot of money because they are sorting, they are selling the waste, because we are increasingly working, we are increasingly in what they call a circular economy. In a circular economy, there is no waste. There is no waste. What is a waste somewhere can be useful elsewhere. Okay? So those condemn iron, those condemn iron people, you see, they are making a lot of money. They are making a lot of money because they are selling those metals they are collecting. They are selling and making a lot of money. So you have to go and register. And then if you register as a social enterprise, you can raise money. It is easier to raise money from grants, from philanthropists, as from crowdfunding, and from venture capitalists. You can raise money from all this. If grants are low, grants are provided by government, corporate bodies, and philanthropists, and they are not usually repaid. They're not usually repaid, but you must give accounts. You must give accounts of judicious use, or show proof of judicious use of the grant. You must do that. For crowdfunding, you can ask to be funded. And if it is a good cause, I'm sure that you'll be so funded. And then venture capitalists, if it's a good product, there are persons that are willing. There are persons that are willing to fund you. And then finally, you have to market your program. You have to market your business. And the way to market your business is to use social marketing, to use the social marketing method. We taught you social marketing in that course on health promotion and social medicine and health promotion. So we taught you social marketing. Social marketing is the best way. To advertise your business setup. Remember, the social marketing has been formally defined as the application of commercial marketing technology in the analysis, planning, execution, and evaluation of programs and products. Voluntary behavior of the target audience in order to improve their personal welfare and that of society. That is a complex one, but social marketing is how you can use commercial marketing methods to encourage people to use their products. And it's just a matter of working on the price. Remember, if you are a social enterprise, you should be able to provide the service at the product or the service at a reduced price. you know how to use create adverts, captivating adverts that will encourage people to change their behavior or use the product. Okay, so I've actually gone through, you have the slides, and I'm sure you should be able to just also look at the slides, and then I'm sure you will understand. I don't know if there are questions or comments. Yeah. I don't know if there are questions or comments. Anyway, you have the slides, and we hope. I think we'll also take a break tomorrow, which means there won't be any lecture tomorrow. We'll take a break tomorrow. So you use tomorrow to look at the slide, because there will be a text on Monday. There will be a text on Monday, and that text will be based on the slides we have shared for this course. Hopefully next week, Dr. Alabere will come in and give you lectures on the management. In fact, those of you in MPH, anyway, let's just see. What he'll be teaching will be slightly different, because this one he will tailor it to business, and not healthcare. He will tailor it to business. Okay. I don't know if there is any question or comments or anything, any question you want to ask me, be it on the short course or the progress of your exam, of your program. Those in your MPH, you are probably one of the few. You are the few program. You are the only one with an additional with a course. You have not finished that health. That environmental and occupational health, it will be done early next year. Okay. Okay. So I don't know if there is any question or comments. If there is none, then if there is none, I will just thank you for listening, and then especially thank the lady that asked the question. Okay. So thank you very much, and have the best of the rest of the evening. Thank you. So tomorrow,
Thank you, Prof.
Tomorrow will be lecture free.
Thank you, Prof.
Thank you.
Yes,
Thank you,
Prof,
Prof.
question, please.
Prof, I also have a
Prof,
question.
I just want to inquire something.
Why is that?
Good evening, Prof.
Polycarp. Is it Polycarp?
Best man, sir.
Best man. Okay.
Sir. I just want to inquire something. First, thank you for the lectures. What I want to ask is, with regards to our names, based on what you are noticing, following the exams and tests that you have been written, I noticed that for me, I have 3 names, and only 2 names has been reflecting on the portal. So,
is it a problem?
let it not be something that will now reflect on our certificate when we are done.
What is that? Best man. Don't worry. You will be able to. Before they will script your certificate.
Okay, sir.
You'll be asked. You'll be asked how you want it. You want your names, although you have to back it up. If you want to,
Yes, sir.
remove man, you have to go and swear affidavit.
Yes.
But you can actually.
Okay, sir.
So thank you very much.
Thank you, Prof.
I think we are coasting home. What is left now is the research. So please, I'm sure that all of you would have submitted your topic. I've not checked, but I know that deadlines don't make a lot of meanings to a lot of us. They don't. If in fact, after if you go back next year, if you do it in January, I will see some persons that will say they have not submitted theirs. I don't know. I don't know what happened. You see, some people don't just. I know that people disappear. They disappear to appear. They disappear to appear.
Sometimes we don't catch up with everything, really. That's the truth.
No, I mean the information, like this information on submission of research topics. Some people, I don't know. It seems, I don't know which platform. Probably we have to be sending messages directly on the what is it called now? On that LMS. I know the LMS has that function to send message. Perhaps we have to begin to send messages directly. But
Prof, sir, those who have submitted, when I was in supervisors.
no, don't worry. We will work on that. We will work on that.
Prof, good evening, sir. Thank you very much for the lecture. The slides we have does not have the social marketing.
Okay, I think I have. Okay, which means I have to send this one. Thank you. I think I was asked yesterday. Okay, so I will check. Thank you, and have the best of the rest of the evening. Thank you very much.
Thank you, Prof.
Thank you, Prof, and good night.
For the lecture. Have a blessed week.
We don't know what to research on. No. Honestly.